Hello, everybody. Today I would like to give a presentation on being stroke aware. I'd like to discuss recognizing the signs and the symptoms of a stroke and how important it is to actually act fast if you think that a person is actually taking a stroke. What exactly is a stroke? Well, there is two different types of strokes. There is an ischemic stroke or a hemorrhagic stroke. The ischemic stroke, it's basically when a particle in the blood blocks up the vein and causes a clot, which in turn means the brain is being depleted of blood flow through it. A hemorrhagic stroke, this occurs when there's a rupture to a vessel in the brain causing a leak of blood to the area of the brain. It needs to be like the other particular type of stroke. This one needs to be dealt with immediately also. Now, the early signs and symptoms of a stroke, it's pretty important to be able to spot these. It is usually slurred speech, paralysis down one side of the body. A person's face will appear to be drooped on one side of it. They may complain of having blurred vision. They may even feel very unsteady gait. So if you suspect a person has all these kind of symptoms, it's pretty kind of, it needs to be addressed and they need to be brought and given medical attention pretty much immediately. Causes of stroke are caused by lifestyle can be a big impact on the cause of a stroke. High blood pressure can lead to strokes if it's undetected. You need to have regular blood checks, keeping an eye on your blood pressure, making sure that it's okay. And if your doctor feels that your blood pressure is too high, they may suggest medications to help kind of keep the blood pressure at an acceptable level. High cholesterol is also a big factor in strokes. The excessive cholesterol can cause a blockage in the veins, and this can lead to a stroke. So also that cholesterol test can be done in your GPs. They can do that for you, and if you cannot control it, keep your high cholesterol down with diet and just kind of making kind of lifestyle changes. A medication may also be introduced to help reduce your high cholesterol. Heart disease is also another big impact on strokes. This can lead by clots in the blood, so that is detrimental to the body. Obesity, like that, is excess body fat can higher your cholesterol and so enables a stroke. So keeping your weight under control, eating a good healthy diet and watching what you're smoking, drinking, all that kind of thing, eliminating all those kind of things will really benefit your health. Diabetes is also another one bit. The blood sugar levels, if they aren't being monitored correctly, they're too high, too low. This could also cause a stroke. So generally speaking, lifestyle is a big factor of a stroke. It's actually like in Ireland alone, there's about 7,900 people take a stroke annually. It used to be kind of thought that it was an illness of the elderly, but generally speaking, it's between the ages of 70 to 80 people they thought were at risk, higher risk of taking a stroke. But now it's actually showing up that younger people are presenting with stroke signs and symptoms, and actually after having taken a stroke. In people as young as in their 20s or 30s, they're preventing with strokes to the A&E departments. So really, lifestyle is a big impact on causing of stroke. It's so important to make sure that you actually get help, because the quicker you get the help, the quicker you can kind of revert the symptoms and you can stop them from progressing. Like the fast is the way they actually, that's what they call actually the diagnosis for it, actually to try to fast track it. So obviously you're checking for the face. So you ask the person to smile, the face appears drooped, it's an indication, or if it's feel on one side, it could be a little bit more drooped down. If the person can't raise their arms, or does one arm remain downwards, or it's difficult to move, that's another indication of a stroke. The speech comes across as being very slurred, can be hard to understand. The person might keep repeating the same phrase over and over again. Um, this is when you know it's time to actually go seek medical help immediately. Every minute counts to reduce the risk of brain damage and disability. Like, you can have an early warning sign, stroke, which would be your transient isothermic stroke. It's kind of where the person could take a little kind of, they could get a blockage in the vein, but it disperses itself, so things revert back to normal within 24 hours. But that's a really an indication that you're really building up to take that stroke that can cause serious damage. So if you feel you're with somebody who is presenting with those symptoms, that giving those signs, it's really important to get them for medical health help immediately. I hope this presentation was of some kind of benefit to you, and it'll reinforce the seriousness of stroke and make you a little bit more stroke aware. That concludes the presentation now. So I'm just going to open the floor up to yourselves if anyone has any questions there that you might like to know about strokes or anything at all.
Yeah. What should I do if I think someone's having a stroke?
Ali, it's a very good question. The first thing you should do is get emergency help. Contact emergency services, give them all the signs and symptoms that the person is suffering from. Don't delay. Even if things start to slow down a little bit and the symptoms aren't presenting as quickly as they were initially, still go and get emergency services help. Okay. Anything else?
Yeah. What are the long-term effects of a stroke?
Strokes, they can vary. The long-term effects, you can have weaknesses and paralysis on the limbs. The speech can be very slurred. You might have to get some speech and therapy afterwards to actually kind of get the speech back normal again. For a lot of people, they may suffer with memory loss. They might find it difficult to actually put sentences together, to actually be able to form the sentences and to communicate. This can have an awful effect on their emotions. Obviously, if you can't communicate with people and let them know how you're feeling, and it's going to really have a terrible impact on you and your whole life in general. Um, they can have difficulty swallowing, which means that some people would have to be, their food would have to be pureed down. They wouldn't be able to eat their everyday normal food that they would normally be used to eating. They may suffer vision problems permanently, and so generally speaking, the effects of a stroke are detrimental to a person if they're not treated. So that's why it's so important to actually try and get immediate attention, medical attention for a person to try and slow all these things down. Anything else?
Yeah. So, what is the recovery like after stroke then?
Recovery depends on how severe the actual stroke was, how early medical intervention was given. Um, some people, they may need a lot of physical activities, physical therapy to actually help them getting their body moving again, because the body has been paralyzed. So it kind of needs to be taught how to walk again, how to lift things, how to grip things. Their speech as well, they may need an awful lot of speech therapy. Because unfortunately the vocal cords are badly affected through a stroke, and they, to even just communicate, just general learning how to communicate, they may have to implement different ways of communicating by using maybe typing, keyboarding, that kind of stuff. Um, Occupational therapy is also a big factor in helping a person improve after a stroke, like getting them back out there, getting them get back to doing everyday living things like, simple things like bathing and showering, things like that. They're going to need help with. And I mean, they're going to need so much support emotionally from friends, family, their medical team. It's just like it can be a very, very slow process. But like if they get the early intervention, like I was saying, these things can kind of be reduced down for them, the time frame of them.
Yeah, and you spoke about TIAS, and are they dangerous?
Well, yeah, because they are an early warning sign that a person is building up to taking that bad, nasty stroke that's going to be detrimental to their lifestyle. So if a TIA is actually ignored, um, it's definitely important that these they're not ignored, and that it is a dangerous, because it's an indication that you're going to take a stroke. You may not take it today, tomorrow, but it's inevitable. It's down the road for you. So the TIAs are kind of that early warning sign to help prevent you actually taking that stroke that's going to be so changing for you and for your family.
Okay.
Yeah.
And that explains a lot. Thank
Yeah,
you.
thank you. Hopefully that's cleared up some things for you now. And if you have anything else, yeah, okay. If not, we'll leave it at that. Thank
Okay.
you.
Thank
Thanks
you.
very much.